This video features two patient stories. The patients shown are undergoing joint replacement surgery for arthritic conditions, treated according to the enhanced recovery pathway. Their stories are typical of the treatment and outcomes for these procedures, but everyone is different, and your treatment and recovery may not be the same. We hope this video will answer some of your questions and will also help you to think about questions you may have about your specific circumstances. And you should not hesitate to put your questions to the nursing and surgical team when you see them in the course of your treatment.
I was training to be a sports therapist. I was running around and felt a tear in my knee and realised then something had happened because I couldn't continue. And now I left it probably a year or so before I went off to the doctors. So I've got arthritis now in the knee, and that's why I've got the constant swelling and heat coming from it. And it wasn't until the consultant said, well, the only option available to you is a knee replacement. The sort of mouth dropped open. To be perfectly honest, I could feel the tears welling up.
Right, good morning ladies and gentlemen. My name is Sister Maureen Opande. I am looking after the orthopaedic pre-assessment today. Patients arrive at about 8 o'clock. There's a completing of paperwork at that. There's also the occupational therapist who see all the try and take their measurements and all that and get them to fill out some forms. As well. We normally have a talk about hip and knee replacements. I would like to welcome you all to our knee school where we'll be talking about knee operations only. It's normally a half-an-hour talk about the procedure, 10-minute talk by the nurse, followed by another 10-minute talk by the physiotherapist.
Good morning, I'm Janice Draper. I'm one of the physiotherapists that's part of the team over on Ward 4, and we'll be seeing you while you're in hospital for your knee replacement.
And 10-minute talk by the occupation.
The occupational therapist is looking at basically just the practical everyday activities that you need to do when you go home.
It's normally just information session only. The patients are given the opportunity to ask questions when they see the nurse or when they see the occupational therapist, and between us, if we can't find answers, then we will go to the consultant and get some answers.
And just run through this form that you very kindly filled in for us, the questionnaire here.
In their assessment is in making sure that the patients who are coming in are actually fit. Your assessment, I'd like just to confirm that I've got your correct details. Or get the anaesthetist input prior to the patient coming in. Please. We are trying to make sure that that pre-op assessment is very thorough. We also take some blood tests from the patient, and we also do ECGs. Great. We also take their weight and height. They also have an MRSA check done. Ready? Yeah. All right. Just slightly out. Thank you. The whole session takes a whole. Patients who are fit will have their admission letters given to them. We also have a copy of a leaflet about the knee replacement. And those who are not fit will either be brought back to see their anaesthetist or will have to be sent off to the various specialities. Perhaps they need a cardiology referral.
During the pre-assessment, I saw the occupational therapist, took measurements of my leg, and I was told I would need to not lower than 17 or higher really than 17 inches. I am extremely anxious about it, but positive outlook on things, and yeah, it'll be fine.
The patient usually arrives at the ward at 7 and the nurse shows them to their bed. And always they're given a key nurse. Then we do the observations. We go through the whole theatre checklist with them.
Okay, do you smoke?
We always put on TED stockings, and that's to prevent DVTs. Every admission is got MRSA swabs done on the ward, which the nurses do. Blood is always taken for the hips and knees.
Any loose cap, crowned or false teeth?
Yes.
No. Any dentures?
Oh, not loose. No, that's right, no.
And then they're seen by the anaesthetist.
My name's Dr. Stapleton. I'm the anaesthetic consultant who works with Mr. Kachuria. How are you? I'm good, thank you. Good. Now we're giving you a new knee today, is that right? That's right, yes. Exciting, isn't it?
The registrar and the consultant always put a nice pen mark up there. When the porter comes with the trolley, a trained nurse always rechecks all the paperwork with the identification band, and then usually a healthcare assistant will go down to theatre with that patient and won't leave the theatre until the anaesthetist is happy.
Right. Now, my darling, what we need you to do is to assume the position so we can pop the spinal in. Okay.
The spinal anaesthetic we use makes you completely numb from the waist down, and the most anybody ever feels is sometimes you're aware of some movement.
This is really cold. All right.
We make sure that the spinal is working absolutely properly before any surgery is started.
Okay. That's all done.
And so, you know, there isn't any chance of feeling any discomfort.
It's starting to get nice and warm and tingly.
Some people want to be wide awake and cognizant all the way through, and some people would rather be made much more sleepy, and we can, generally speaking, achieve both of those.
Can you lift this leg up? Oh. Good, that's the spinal working really well now, my darling, all right?
The drugs that we use to make you sleepy just give you a feeling of well-being and calm, and most people actually with sedation sleep all the way through the operation and wake up at the end and are amazed that their surgery is completed. But there isn't any chance of feeling, you know, the discomforts of the operation. The most that patients can be aware of is to hear some voices and noises under. But then we speak about that prior to the operation so that they're aware that's normal and that it's, you know, it's nothing to worry. Doesn't mean to say they're suddenly going to feel any discomfort, because they won't.
The majority of the patients we see have what we call primary osteoarthritis, means wear and tear in the joints as they grow older, and there's no real cause for it. And then there's a small subset of patients who have different inflammatory disease like arthritis, or they may have fracture in the past or infection in.
Antibiotics she's had, shaving she doesn't need, warming is on, VT prophylaxis with around 10 o'clock tonight. See, the green line here is ECG, which we monitor all the way through, both in the anaesthetic room and here during the procedure. This yellow line here is pulse oximetry, and what that measures is essentially the amount of oxygen in the blood. So to make sure that she's breathing adequately and she's got enough oxygen, which she has. 98 is very good, it should always be in the high 90s. She's breathing nicely. This is actually her levels of carbon dioxide, which measures how well she's breathing, and that shows that her respiratory rate is fine. So it's how we measure her well-being as well as being in contact with her. But as you see, she's sleeping very nicely now. She slept through most of the procedure actually, very comfortably.
So we're almost done. Just the skin which we staple. Staples give you as good a scar, but also gives you security. The patient can bend their knee without disrupting the wound. So you can have a look. We started at 9:18. It's 10 past 10. So tourniquet went up at 9:18. So it's taken us about 52 minutes, and that's how long it takes.
When you're doing your surgery, make sure they are the shortest period in theatre, least amount of drugs, and post-operatively are not in pain and have a pleasant stay and recover quicker to go back to their own environment at home, where they, I feel, recover better than in a hospital environment.
Roll over onto your bum, okay? That's lovely. Now over to the other side. Lovely.
When I came round for the operation, I did notice I couldn't feel my legs or move my legs, and that was quite unnerving, because I would lie there and stare at my feet and will them to move, and then nothing happened. and when the nurses kept coming around with like an aerosol freeze thing and spraying it on different parts of your body, asking if you can feel it, and you would say no, and they'd go, "Oh right, okay, it should come back soon," and off they go. That did unnerve me a little bit, but apart from that, it was fine.
Right, so Barbara is now 3:45 since knee replacement, 5.5 hours, and spinal's worn out, but in no pain. No, any pain?
No pain.
Okay, and lift your leg up straight. And you can see she can lift her leg after knee replacement. So pain is the issue which doesn't let patient mobilize. Okay, so she can do that. She's had a big operation, and she's now hopefully going to walk for us. Okay.
Well, once I'd got the feelings back in my leg, they then got me up, and I think I walked with crutches for maybe, I don't know, 50 feet or so, something like that. Felt fine because obviously I didn't have any pain. So, and I suppose I was expecting to actually feel it, but I didn't. So.
You feel okay?
Yeah, not too bad. It's a little wobbly, but it's fine.
You just go up to the door and then come back, yeah?
I'm going to do this next week in my 4-inch heels.
We used to put bottles in, but the risks are higher, so we don't do that.
I was having pain over a period of time, and it was 2 to 3 years, and then it just gradually getting worse and worse and worse, and it was getting to the fact where it was infringing on my life and things I was doing.
Good morning, Jacqueline. Good morning. My name is Mariana. I'm your nurse for today, and I'll ask you some questions.
So the GP agreed to refer me to a specialist who agreed that I needed a hip replacement doing.
Okay, Jacqueline, if you'd like to get onto the trolley.
And did I want it done rather than later? And I said sooner, because then I could get back to having some sort of quality of life. It affected my life every day, my sleeping, walking, being with my children. Obviously I had childmind, so it affected how I was with the children. I couldn't get on with them as much. I couldn't stand up for too long, I couldn't sit down for too long. It was just, you know, and I wasn't sleeping. So it was just getting to a point where it was totally unbearable. When they told me I had a hip replacement, I cried. First, initially, it was shock. That being so young, I needed to that was the only, you know, the only option available was to have the whole joint replaced. But then it was joy because I could then get back to some semblance of normality.
This has got coating on it, which is called porous coating, and the idea is for the bone to grow into this socket. Okay, so this is a press fit socket. We don't use any cement, which has been shown in cups to be bad. And in young patients especially, you want her bone to grow into it. Once it's grown, it should not become loose. So this is a special dressing which can stay on 7 days, and it seals the wound, so we don't have to keep touching the wound. So patients usually go home with this. Yeah, and we're just going to put these pillows in between the legs. The legs apart means it's more stable, the hip, so that she doesn't wake up and flap out something, which she won't because the spinal is working still. She's been on the ward 3 hours, and you want to speak to Jacqueline, see how she feels. Jacqueline, are you feeling sick at all?
No.
Any lightheadedness?
No.
Pain?
No.
So you feel you're ready to get up?
I am.
And you've had something to eat and drink?
I have, yes.
So you can say, if we control patient's pain and the way we do it, after you saw what we did to her, it's amazing that simple things, how pain is well controlled, and she's ready to get up now.
Operated leg, good leg. That's it. Crutches. Well done. Okay. Go back. Yeah. Turn around to the tail and the crutches round. Nice and wide. So operated leg.
Morning, Jackie. Morning, hi, do you want to come through? How are you?
I'm all right, thank you. You?
Yeah, not bad. Yeah.
Physiotherapist is one of a wide range of people who get involved with musculoskeletal. Often people these days will see their GP or nurse practitioner first, or more commonly we have self-referral to physiotherapy.
Basically, she wanted to see how I've been getting on with the exercises, how I was walking, because I was walking from side to side still, and I had to retrain my brain to think about what I was doing so that I walked straight.
Come out here. Can I get you to walk towards the brown door and then back?
My leg is still slightly turned. The exercise, carry on with the exercises, that will correct itself. I knew straight away that it worked because the pain, the nagging, constant pain that I had gone. I knew straight away it worked. So, you know, that was fantastic. I felt jubilant because I just didn't have that pain anymore, which anybody that hasn't had arthritis or had that nagging pain, constant pain, couldn't understand, but it wore you down. But it'd gone, which was brilliant. So, yeah, they discharged me today.
So it's been about 6 weeks now since you were with us, and you had a partial knee replacement of your right knee. Today in the clinic we've been seeing mainly follow-up patients who've been having joint replacement procedures. It's the way we really monitor how patients have got on in the early stages. So at 6 weeks we like people to be becoming more comfortable, more mobile, and really starting to get back to normal life, and that's really the point of doing the procedures. And that's okay, just bend up for me, please. Lovely, so a nice bend at this stage. Fantastic. So really I look at it, if we can inform patients, educate them, make them more comfortable in the post-operative period, then we can more reliably get them to a point whereby they're comfortable enough to go home at an earlier stage. Okay, Mrs. Cup, it's been 6 weeks now since you had your left open hip replacement. Yep. How have things been for you?
I expected to be in a lot more pain.
It was very interesting talking to Mrs. Cuff about her post-operative stay. She spoke very highly of the service she received in the pre-assessment clinic. She felt that she was very well informed, and she felt at no point was she uncomfortable. Lots of the physiotherapists had concerns about mobilising, but found them very confident, very experienced. They knew exactly the way to mobilise her afterwards.
Oh, it's lovely to think I can get up and walk about. I haven't got that horrible naggy pain right down into the knee, because it was right the way down through.
And she was delighted to go home 48 hours following her surgery.
The video you have just watched featured typical examples of orthopaedic surgery procedures when the process goes well. Your experience may differ, but at all times you'll be given and should expect the best possible care.